How could Tu Youyou deceive the Nobel Prize and the Lasker Foundation Award in Medicine? Lecture 3. How Tu Youyou lied about her 1972 clinical trial results and tampered the original clinical data. 2015 Nobel Prize in Medicine winner Tu Youyou was an academic cheater and a liar. She was not the crucial contributor of 523 project in finding the new anti-malaria drug artemisinin. The Chinese Ministry of Health selected her as a candidate in attempt to bring the best political propaganda effect for the ministry. As a matter of fact, Tu Youyou has made the biggest academic cheating scandal in world scientific history. In the 2015 Nobel Prize speech, Tu Youyou deliberately lied about the results of her clinical trial on Hainan Island in 1972. Please listen.
1972年8月到10月，我们开展了青蒿乙醚中性提取物的临床研究。经过30例恶性尿和间质尿病人治疗全部见效。
In the video above, Tu Youyou said, from August to October 1972, we conducted the clinical trial research by using the neutral ether extracts from Qinghao. After treating 30 VVAX and 5 cyprian malarial cases, all patients were cured effectively. Now we have two suspicious questions. Question 1. Which drug was used for the clinical trial? Question 2. Could this be another lie that all patients have been cured effectively? Tu Youyou already said that the neutral ether extracts from Qinghao was sample 191. In our lecture 1, we proved it was very toxic and killed 80% of mouse in the experiment. Therefore, the neutral ether extracts from Qinghao cannot be used as a drug for the human clinical trials. Obviously, reducing toxicity was necessary before clinical trials. Historically, Tu Youyou said that her sample 191 had 100% inhibition rate against rodent malaria. However, after checking original documents, we found that was a lie. The real overall inhibition rate was only 20%. This time, Tu Youyou said that all patients were cured effectively. Was that true? We have to check the original documents. Before seeing the original documents, we should not simply trust her report. In 1972, after the clinical trial, Tu Youyou wrote a report to 523 Project Office describing the trial result. This report was edited into the booklet with the title 青蒿抗疟研究 or 青蒿 anti-malaria research by Tu's employer, the Institute of the Chinese Traditional Medicine Research. The right picture is a cover of this booklet. This booklet was sent to the Nobel Prize Museum in Stockholm by Tu Youyou as an exhibition document in October 2015. The left is a picture that Tu Youyou held this booklet inside the Nobel Prize Museum. The left picture is a copy of the report of Tu Youyou's 1972 clinical trial printed in the page 26 of the booklet, whose title is Observation on the Clinical Efficacy of the Neutral Extracts of Qinghao in 1972. This is the complete English translation for the above clinical trial observation report. This report is exactly as Tu Youyou said, all patients were cured effectively. However, there was a note in the last line. See Table 1 and 2 for details. This is Table 1 and Table 2 in Chinese. Now we translate them into English. The Table 1 was made by Tu Youyou, and the Table 2 was made by Beijing Army Hospital. Immediately, we can see the difference. In the Table 1, we can see in the choice of efficacy, there are only two options for selection, cured or effective. However, in Table 2, there are three options, cured, effective, or ineffective. Remove the option ineffective from the efficacy choice was definitely a cheating. Now check the second and fourth cases in the group of falciparum malaria types. They both have no the average temperature normalization time. Moreover, they also do not have the average parasites clearance time. Therefore, there were two ineffective cases. However, Tu Youyou marked them both as effective cases. That was absolutely wrong. Now check the first three cases in the Vivax malaria group. It was clearly written in the note that one case, parasites never turns to negative. This is another ineffective case too. Therefore, among 21 cases, 2 falciparum cases and 1 Vivax case were ineffective. However, the Table 1 was not the original document. Tu Youyou could reject all conclusion by saying the data in Table 1 was not accurate. Therefore, we must find the true original documents related to Tu Youyou's clinical trial in Hainan in 1972 before we can reach a final conclusion. 523 Project Office Leader Zhang Jianfang made a remark on Tu Youyou's report about her clinical trial in 1972 as the following picture shown. His remark tells us the original documents was a summary of the clinical trial verification, or in Chinese, 临床验证小结. According to the official rule, this summary should be written by the local hospital doctor in charge of clinical trial and sent to the 523 Project Office independently. However, it was Tu Youyou to carry this summary to Beijing. That would give her a chance to tamper the document. There was no electronic typewriter or PC in China at that time. The summary was handwriting on papers. Totally, it should have 8 pages. However, after back to Beijing, Tu Youyou used scissors and glue to cut the summary to 7 pages, then made a copy for reporting to 523 Project Office. The following picture was a copy of summary received by 523 Project Office. Without counting the cover page, it only has 7 pages. Now, let's take a close look at those pages. Look at page 3 first. It is very strange that Table 3 was listed immediately after Table 1. Therefore, we have a question. Where was Table 2? Obviously, it has been cut away by Tu Youyou with scissors. Now look at page 1. It was written, select 3 falciparum and 1 vivax malaria cases to take drug chloroquine as a comparison observation. However, the data about taking chloroquine was completely gone from this summary, which must be recorded inside the disappeared Table 2. Now we have another question. Why Tu Youyou wanted to remove the data of chloroquine observation from this summary? Certainly, the data was not her favorite. If all 3 falciparum cases were killed by chloroquine, but she had 2 failed falciparum cases, then that comparison would be humiliation for Tu Youyou. Therefore, she removed the Table 2 with scissors and glue instinctively. In her Lasker Award paper, The Discovery of Artemisinin and Gifts from Chinese Medicine, Tu Youyou said about the 1972 clinical trials as following. Tu Youyou not only lied that all patients will rapidly recover from the malaria symptoms, but also said that chloroquine was no good for the clinical patients. It was very ridiculous that Tu Youyou intentionally removed the chloroquine observation comparison data from the report, but saying that the chloroquine was no good for the clinical. Where is the evidence data? Because the title of this document was called Summary of Clinical Trial Verification for Drug Number 91. Tu Youyou made a handwriting remark in the end of page 7 to explain that drug number 91 was the same as neutral ether extracts from medicinal Qinghao. However, this was a lie, because the neutral ether extract from medicinal Qinghao was very toxic. It cannot be used in human clinical trial as an anti-malaria drug for the safety concern. Therefore, Tu Youyou's teammate, Nimo Yun, tried to do some actual refining work for reducing the toxicity and obtained the new drug number 91. Nimo Yun's work was reported in website of Wikipedia. This is a copy from Wikipedia website to report how Nimo Yun to produce the new drug number 91. The top part was the Chinese report. The lower part was its English translation. From Lasker Award to Nobel Prize, Tu Youyou never ever talked about drug 91, because she did not want any judge to know that her sample 191 was very toxic. On page 1, Tu Youyou set up the criteria for selecting patients for her clinical trial. Number 1, all patients must be from 15 to 50 years old. Number 2, nobody has heart, liver, kidney, or any underlying diseases. Number 3, no more than 2 episodes for vivax malaria patients. Number 4, no more than 3 episodes for falciparum malaria patients. Number 5. No other anti-malaria drug was taken within 1 week before the episodes. All Tu Youyou's selection criteria were not reasonable except the last one. This was because 523 Project Office never set age restrictions for patients in clinical trial and never required that patients must not have any underlying diseases. Moreover, the office never required that clinical trial patients must be within their first 3 days of malaria symptom. Tu Youyou only accepted the young, healthy, and light symptom patients in her clinical trial. In fact, this was academic cheating in disguise. On page 1, Tu Youyou designed a peculiar standard for drug effective for treating malaria as follows. Effective. The symptom gets controlled within 72 hours, no matter the blood parasites turn to negative or not. Here, the symptom get controlled means the temperature gets normalized. 200 years ago, the Chinese traditional physicians treated malaria only considering to control the fever of patients because they did not have the knowledge of malaria parasite. Moreover, they did not have available equipment to check a plasmodium level in the blood. In 1972, Tu Youyou had the knowledge of malaria parasite and equipment to check its level. Why she still ignored the blood malaria parasite? Actually, this was Tu Youyou's cheating strategy, such that she could get more false effective cases in her clinical trial. Now let's read table 1 in page 3, which reported the clinical trial result for all 11 Vivax malaria cases. Tu Youyou reported that 5 cases were cured and 6 cases were effective. However, on the first line of page 4, we can read, among 3 cases in Plan 1, the parasite of 1 case never turned negative. This was obviously an ineffective case, but was reported as an false effective case by Tu Youyou. Now we continue to read table 4 on this page, which reported clinical trial results of 9 falciparum cases. The local hospital doctor clearly wrote that 2 cases were ineffective. Below the table 4, the local hospital doctor even wrote more words to explain why they were ineffective. However, Tu Youyou reported to 523 Project Office all as effective cases. Now let's compare the following 2 tables. The top one was the report in summary written by the local hospital doctor. The lower one was the report to 523 Project Office re-edited by Tu Youyou. Those 2 tables were supposed to report the same thing, the clinical trial result of 9 falciparum malaria cases. However, Tu Youyou changed 2 cases from ineffective to effective. Therefore, this is a solid evidence that Tu Youyou made cheating in 1972. But Tu Youyou continued to cheating to Lasker Foundation and the Nobel Prize Committee in 2011 and 2015. We appeal the Lasker Foundation and the Nobel Prize Committee to launch the investigation whether Tu Youyou made cheating about her clinical trial in 1972. Did she intentionally choose young, healthy, and light symptom patients for her clinical trial? Did she tamper with the original clinical report? If all were true, then her Lasker Award and Nobel Prize should be revoked for the sake of scientific ethics. More Tu Youyou's cheating material will come later. Bye-bye.